Dr. Ogi. I hope you've been enjoying some of the videos that you've been watching, and I do this for fun. This is an absolute riot for me. I have a ball doing this, and I hope to infuse you with the same passion that I have for doing what I do. See, now I want to talk to you about I guess a myth that we have in our profession. And I just finished teaching my seminar in Niagara Falls a few weeks ago. And one of the doctors there approached me afterwards, and this is what started my train of thought. And he said, you know, I thought that what you teach is all about attracting new patients. And I've learned that there really is no such thing. And that was a huge revelation for me, see? And I want to just expand on this myth for a minute, because there are many coaching programs out there, and they all teach you basically how to attract new patients. Either you market your brains out, or you advertise like crazy, or you do screenings, or you do whatever the hell you do. But the whole idea is somehow to attract these people so they come into your office. And my thinking on this is a little bit different, because I've got to tell you, there really is no such thing as attracting new patients. There is no better mousetrap that you can create that will somehow magically transform mere mortals into lifetime chiropractic patients that refer to you, that refer all the children to you, all the friends, and pay you on time and keep all their appointments and get well and stay with you for a lifetime. There is no such thing. Okay? It's a myth. See, that doesn't mean it doesn't happen. Absolutely. I mean, that's the kind of practice I had, and it happens with many doctors. See. And that's ultimately what you want. But there's no such thing as actually attracting new patients to you. See, it works the other way. They have to be attracted to you. See, there has to be something about you that people find absolutely engaging and attracting to them. Okay, there's nothing that you can do, no ploy that will attract people to you. See. And if you do that, some marketing thing and some screening and some whatever it is that you do, some salesmanship game that you play, you will find in most cases, and you know this to be true, people will come to see you, they'll stay for a little while, 3-4 weeks, and all of a sudden they're gone. And the reason is because now it's costing them money. They came in as a freebie most likely. Now it's costing them money. And they found out that this is not exactly what they want. This is not what they want. This is what you want, see? They've all of a sudden woken up and say, no, wait a minute, this is not what I want, see? I don't want this, see? And the difficulty is that most doctors that I speak with don't know truly how, let me rephrase that. Most doctors I speak with don't really understand fully what it is that they really do. Like, what is it that you do that you can translate at a grade 8 level to have a patient understand exactly that? How can you take what you do, which is very complicated, I mean, scientific, clinical, whatever, and translate it at a grade 8 level so the patient says, oh my God, I love this, I want this, give it to me, see? So, the key is to have you really, really deeply understand what it is that you do every time you adjust. When you adjust that subluxation, see, what is it that really happens? What takes place, see? And what is it possible for you to do? Okay? Now, a lot of doctors don't know that when you adjust, you set into motion a cascade of events that will actually take a subluxation pattern that's been formed and a degenerative pattern as a result of that, and we'll actually slow this thing down, we'll actually eventually stop it, and eventually start to reverse the process. Now, I say this because I'm kind of the expert on doing this on the planet. I'm the one that wrote a number of research papers on it years ago, when it was, to even talk about the subject was considered to be heresy in our profession. I mean, chiropractors were slaughtered for even thinking that way. I'm teasing. And so I've got a lot of experience when it comes to this particular topic, and I've written papers on it and so on and so forth. See, but if people totally understood what it is that you can accomplish with your hands, they will follow you to the ends of the planet. See? But for that to happen, you have to be totally, absolutely crystal clear and certain on what it is that you deliver. see? But at the same time, you also have to be absolutely crystal clear and certain on the devastating effects of a subluxation. What is it that this thing can cause? What is it? Well, it can unleash a whole cascade of events. Physiological effects, there's chondrocyte mitosis, there's water retention, the disc starts to degenerate, there's calcium deposits. I mean, there's a whole slew of events that takes place, ending eventually in ankylosis and fusion. I mean, that's the whole gamut that's produced. And so you have to be totally clear on this, and you have to make sure that your patients are totally clear on it so they understand it, see? Because if you use the analogy of a dentist, dentists are very clear on how to explain this to a patient, see? And all people know what a dentist does. They drill your teeth and they put crowns in, blah, blah, and these cavity things that happen and so on. Well, the cavity to a chiropractor is like a subluxation. It does the same thing. It's damaging. You can't taste it, you can't smell it, you can't feel it, but it's there. And it will cause and slowly erode the health picture of a patient. And your patients totally need to know how this works at their level, at a great level, because you've explained it to them in that way, see? And if they know it, you no longer have to attract new patients. They will be attracted to you because they see you as phenomenal. And that's the key. So I look forward to chatting with you. Call me anytime. It'll be a pleasure to chat with you. Email me, call me, message in a bottle, whatever. And we'll have a bloody blast together on the phone. Take care. I look forward to talking to you.